My name is Marvin Malik. I'm the course director of the Northern New England PNHP Health Policy Internship Program. And today we're going to take a brief look at some demographic trends in the U.S. physician workforce and also in practice ownership and AMA membership. So without further ado, let's take a look at those data. Okay, so we'll start off with AMA membership among U.S. physicians. And what you can see in this slide is that AMA membership steadily rose from the year 1900, around the time of just after the Flexner Report, to its peak in the 1950s, which was at 75% of U.S. physicians were members of the American Medical Association. Note that that's exactly around the time when the AMA almost single-handedly uh, funded and implemented a propaganda campaign to uh, reverse public opinion on President Harry Truman's proposal for nationally based single-payer reform that would have included every American. That occurred during the years 1946, 1947. And since then, that reform didn't happen, but for a variety of reasons we'll discuss later among each other, we'll discuss the reasons for the fall in AMA membership. And what you can see is that it dropped right to all the way down to 17% by the year 2010. And then since then, it's risen a little bit. And this last rise is actually not due to people rejoining who were physicians who'd previously been members, but instead by somewhat greater involvement and membership among students and residents, and greater participation by women physicians and a somewhat more diverse cohort of young physician members. So the takeaway, AMA, it currently represents more than 1 in 5 American physicians. Let's now look at the ethnic breakdown of the U.S. physician workforce. And what you can see here is that the majority of the workforce remains white, that 17% of the U.S. physician workforce is Asian, and 6% Latino, and only 5% Black or African American. Though in this study from the AMA work files, 16% were unknown. Apparently didn't respond to the survey. Now we're going to see how those percentages compare with overall U.S. population representation. So what you can see is that whites are actually a little underrepresented. Blacks are underrepresented very badly, and so are Latinos. And to make up for all of those, there's a very significant overrepresentation among Asian Americans. Now, one thing that is worthy of note is that there's belief among segments of the population, including uh, President Trump's entire regime in Washington, that immigration is not good for the country for a variety of reasons. But this Asian physician workforce is essential to U.S. healthcare, and virtually all of them are either themselves immigrants or first generation. So I think that's worthy of keeping in mind when you're thinking about the importance of immigration to the U.S. healthcare system. And the other point there is gross underrepresentation of Latino and Black minorities. as compared to their percentages in the population. So this is something beyond worthy of discussion. It's a virtual crisis in Black communities. Okay, so now let's look at U.S. physician employment data. And what you see here is that the blue line starting at at the top, which is in 1920, upper left, 80% of physicians were full owners of their practice. And that's collapsed to being down to under 30% by 2022. And what you see instead is partial owner, physician-owned group, that they're part of a physician-owned group, are uh, declining somewhat. And the corporate and corporate and private equity ownership are starting to rise, especially since the year 1990 or so, 1980 to 1990, with private equity being the more recent. That's one mostly just in the last, during this century. And that ownership by hospital systems has been growing for a longer period of time, since 1960, and continues to grow. So the bottom line here is that physicians are employees. And thinking back on uh, the first graph about AMA membership, there's seems likely there's a relationship, because in general, physicians are now becoming employees. And for one thing, they may not, especially in primary care, they may not have a lot of the finances needed to join the AMA. And also, they may not feel so much kinship to physicians in general or as lobbyists, but they may feel more solidarity as employees and workers. That's a hypothesis, one we can discuss in our discussion section about these slides. And the overall, to summarize that slide, what you're seeing is physician ownership is steadily declining since 1940. Ownership of their own practices, and non-ownership either to hospitals or corporation or private equity is rising steadily. Big implications. This will have big implications for the future. The other point is that ownership by age is quite distinct, that physicians under 44 and especially under 35 are quite unlikely to be even starting to own their own practices, but are employees and likely to stay that way. And also a difference by specialty. Primary care physicians are less likely to own their own practices. I don't have data on this, but I suspect a lot of this is rural versus urban, where rural physicians may be more likely to own their practices, and especially urban primary care, much less likely. So the scale of corporate medicine in the United States is growing quickly. Just one company, Optum Health, a subsidiary of United Healthcare, the largest health insurer in the US and in the world, they now employ 1 out of every 10 American physicians, about 9 or 10,000. Now, finally, this is the final slide. I wanted to compare physician ownership in some countries with single payer systems, Canada and France. And what you see here is that physician ownership has been declining much more rapidly in the United States compared to these other countries. And given the growing complexity of a multi-payer system with accompanying huge administrative costs, it's very hard not to think that a lot of this decline in physician ownership is due to the massive hassle of all that health administration entails, all that practice administration entails in the US compared to these other developed countries. So again, we'll be discussing all these issues in an upcoming session. I thank you very much for your attention.